Thanks so much, Ron, and thank you to PHF for the invitation today. Um, I'm honored to have my name on the slide with you and with Liza, two longtime partners, so thank you. I appreciate it so much. I'm here representing NNPHI, but of course also our partners at ASTO and FAB, the three national technical assistance partners. So today I'm going to run through these slides and share a little bit of insights into our technical assistance process and highlight some of the TA requests that we've received over the last 6 months to just try to help you all understand the breadth of the different types of requests we're receiving from these recipient health departments. And happy to go into any more detail at the end. I'm also going to call out Whitney Majendi, who's from FAB, who's here with us today, who I've been texting with on the side to say she's also a key member of the infrastructure team. So Whitney, I of course always welcome your contributions, as we kind of get into the discussion portion after some of these slides. But we can go ahead and go to the next slide here. So, as Ron mentioned, you all have been talking about the infrastructure grant and infrastructure in general for a long time. Just to kind of recap, this is an overview of the grant project with the strategies and the sort of brief logic model listed here. But it is, of course, a massive investment into public health infrastructure, focusing on workforce foundational capabilities and data modernization. We can go to the next slide. So this is our technical assistance model. So we, ASTO, NNPHI, and FAB are the three national partners who respond to programmatic TA requests. So that's everything from kind of resource requests, support with program implementation and strategic planning and other elements, to hiring, to all of the kind of pieces that Ron mentioned at the introduction. We also have an element of administrative requests that gets funneled to CDC, but I did want to share in terms of the meatier programmatic requests. To date, over the last 6 months, we've received 361 requests from health departments, then that's state, local, and territorial health departments. So certainly been kept busy. I'll share some of the detail about those, but that just gives you a little bit of a scale of how many requests we're responding to. ASTO, NNPHI, and FAB, or of course, our staff are leading this work with many, many subcontractors and other partners across the nation to be able to be responsive to these health departments as they're kind of getting the work off the ground themselves with this new grant. And I'll kind of go through the TA request the elements first, and then at the end, I'll talk a little bit about what we're calling proactive technical assistance, which is technical assistance that has been, kind of planned, knowing some of the trends and themes we're seeing with TA requests and in conversations with CDC. So some of those things are peer networks training and resource development that we'll be kind of doing to supplement the one-on-one TA that we're offering to the health departments. So we can go to the next slide. So here's just a bit, I'll go through this one very quickly, just about what kind of happens when we get a TA request. So typically, the national partners respond within just a few days of receiving a request. Our goal is within 2 to 3 business days. For more complex requests, it might take more time, but ideally we're getting back to the health departments, to the recipients very quickly. We often have scoping calls with the recipients, which may involve multiple partners. So kind of coming in and having a conversation about what the need is and really starting to build that relationship with the recipients. And then, of course, moving forward with our partners to fulfill the technical assistance requests. And I'll give you some examples now of what some of the requests we've seen come through have been, if we go on to the next slide. All right, so we have kind of different scales, different levels of types of requests. So often we get just kind of requests for information. So we have dealt with requests mostly related to grant administration, budget questions, things like that, as well as some really just quick answers, programmatic TA requests, just asking for answers to questions, quick information that we can offer. And again, we try to respond to those very quickly. So this is kind of the simplest form of TA requests that come into 5. If we go to the next slide, I think the request for resources has been the most common to date. So this has been requests for things like job descriptions, interview guides, hiring criteria. The first 3 or 4 months of the grant or so, 80% of the TA requests were related to hiring, right? Everyone was hiring their workforce directors, their evaluation staff, some data modernization folks, really just getting aligned with the grant requirements. And so we were there to support, to provide some of these resources and help them through getting some of these folks in place. And then, of course, we've also gotten a lot of requests as folks are standing up their systems. So kind of lists of different EHR systems, performance management systems, different kind of tracking data systems that we have been offering, just some lists of recommendations called together from various national partners to just offer some ideas for folks as they start to build some of their system capacity with this grant. Relatedly, we've had a lot of requests. Folks are doing, of course, in these early years, a lot of assessments, right, to understand where they are, where their workforce is. So we've received requests for examples and templates and guides related to workforce assessments, training assessments, equity assessments, kind of all types of assessments. And one of the actual proactive projects that we're doing is to gather a list of the various types of assessments that have been requested and making some recommendations standardized across the board related to what assessments are out there and what we're kind of all pointing folks to. So this one, again, is pretty straightforward. It's kind of a request comes in and we hand them some resources back and maybe do a few calls to kind of walk them through some things, but it's still a pretty straightforward type of request. So if we go to the next slide, this one is a request for feedback. So as folks are putting things together, whether it's RFPs, policies, new systems or processes, they've been asking us for feedback on things. So again, bringing those to our national partners and subcontractors. So there's things like health equity policies. We've had things related to policies actually with the kind of, relationships with their academic institutions in their area. So definitely a lot of just them kind of sending us some things and us kind of looking it over, making some recommendations on how to proceed so that we're kind of in a give and take with those feedback mechanisms. And then the very last one is the most complicated and long-term type of request on the next slide. So that's kind of a request for more ongoing program support. So we've had requests for a variety of things, including, building out employee incentive programs, working closely together on strategic plans. Again, coming back to assessments, we've had TA requests to really get in the weeds with folks and kind of help them think through what kind of their assessment plans will be. So I think there's a lot of different elements here that we've had some longer term, several month engagements with a single recipient to support them and a lot of the planning work before they really dig into the implementation. A lot in this category as well around community engagement. So thinking about partner mapping or partner tracking, and then how to best utilize their current and new partners as they, kind of figure out what to do with all this money. So we've been thought partners in that as well as thinking through who they're working with and how that work is happening. And then, of course, we've had requests for training development and training delivery. So one of the requests that has become kind of a longer term request is a state asking for kind of a revamp of their environmental health 101 training. And we're kind of working with the National Association for Environmental Health to just kind of revamp some of those early trainings and then have them be a little bit state specific, and each state can kind of tailor the trainings to their needs. So that's an example of a single request that came in, but the product will be much broader than going to a single state. So those are some examples, and I'm happy to chat more about those and give some additional ones, but we can go on to the next slide for just some other project updates that we have from the infrastructure grant. Oh, this slide got a little wonky, but I can talk about it anyway. So these are just some TA activities that we're doing, like I said, as a wraparound of the proactive technical assistance in addition to some of the TA request pieces. So, tool and material development, we're doing a lot of things like policy checklists for health equity policies. We're doing some workforce sustainability guides, some various things that have bubbled up in conversations with the recipients. There's several peer networks that are launching. So we have one for the principal investigators, one for evaluators, and one for workforce directors that are all going to be launched by the end of the fall, where folks can get together to share successes and challenges and learn from each other. I already talked a little bit about assessments, but that's definitely something we see in the first 2 years really ramping up and folks trying to kind of understand the lay of the land before they dig into the work. Won't go through all of these trainings and webinars. Of course, we offer a lot of that throughout the year as folks are kind of bringing on new staff and they need to get trained and up to speed on things. CDC project officers are actually doing site visits at each of the recipient sites. So we're working with them to kind of understand what they're hearing at these site visits and how we can take that information back and turn it into some proactive technical assistance projects. All right, we can go to the next slide. All right, so here's a bit more on the proactive TA. I don't think there's anything here I haven't talked about yet. Maybe I'll focus on this orange box at the end, but just to share where we're kind of learning the most from what the recipients need. So right now there's an analysis ongoing of the recipient work plan data. So we were able to get some de-identified and now some identified information from the recipients about what they're working on over the 5 years to help understand some of the trends and try to look ahead to where some of those needs might be down the road so that we can start work on some of those projects and responses before they get to that point in their work plan. So we're definitely looking at trends and data in the TA requests. We do monthly reports on what's happening, what's coming up in the TA requests. There was a lot of accreditation requests, for example, over the summer as a few of the folks are going through accreditation, re-accreditation. And then, of course, conversations in the peer networks and affinity groups and conversations with CDC are always informing some of the themes of the TA that we're putting into some proactive projects. All right, we can go to the next slide. And this is a summary more specifically of some of the proactive projects that are going to be coming out this fall from the FIG, the national partner teams and our subcontractors. So I won't go through all of them here, but you can take a look at some of the topics, again, gleaned from the data sources that I just mentioned on what we're kind of focusing on in this first fall that we have together, and some of the tools and resources that'll be coming out through the fall and winter. All right, and then I'd be remiss not to highlight our new website that just launched a few months ago. So I'll drop the link in the chat in a moment, but this is the best place to go if you're kind of outside, if you're not, a direct recipient or partner, to look at kind of what events are coming up. A lot of the stories, success stories will be featured here. Other training opportunities, resources that are developed for the project, and things kind of for FIG recipients. So if you're ever kind of curious what's going on with the project and what's happening, this is definitely the best place to take a look. So definitely meant for FIG recipients, but also for those kind of working in this space as well throughout the country. And I think that's all I had for you today. Happy to answer any questions or talk in more detail about anything.
Great. Thank you so much, Megan. And if I just may chime in on some other TA as well, workforce specific, we've had requests around prioritizing core competencies, identifying competency gaps, help with the overall workforce development planning process. Because a lot of agencies have really struggled with that for several years. And one of the more recent ones, which is interesting, will help us develop some new techniques, is somehow doing a prioritization process that uses the core competencies as well as the racial justice competencies. And so we'll be looking at a process for doing that. So I think not only is it a way for providing technical assistance, it's also a way, I think, to generate some new methods and new approaches that can be shared with everybody, FIG and outside of that program. So it's all very exciting. So what questions do people have for Megan or comments?
So this may be more a question for Liza, so I'm happy for it to be punted to Liza if need to. Megan, but good job. I was just wondering if there's any speculation about whether a possible government shutdown would affect any of the activities under these grants.
Yeah, I
Josh,
will
you think there could
definitely
be,
let
you,
Liza.
you
Oh,
think
go
that there
ahead,
could be a
Ron.
shutdown? Go ahead, Megan.
I'll definitely let Liza answer more fully, but we were kind of instructed that we're all still full steam ahead. We won't be able to, of course, interact with CDC and our project officers and technical monitors during that time, but all activities will be able to continue. So folks will still be able to make TA requests. We'll still be able to respond to them for however long the government may or may not be shut down. So.
Liza, anything you want to add? Oh, just a thumbs up? Okay.
Well, it's not really thumbs up, I guess, but that's yes, that is exactly what I would say. Yeah.
Great. Good question. Other questions, comments, thoughts, suggestions?
And as folks are thinking, the other program I meant to highlight during that conversation that might be relevant to this group is we had a really great presentation from the health department in Memphis, and they're doing an exchange program with their local university there to get folks into master's programs. So they have been doing sending their current staff to get their master's degrees while they're still working. And it's kind of been this exchange fellowship program, and several other health departments, after hearing this presentation, have been reaching out and trying to replicate it. I think Alaska is working on something with the University of Washington and some other groups. So just an interesting kind of academic practice connection there I wanted to highlight. Oh, sorry, the cat here.
You had somebody joining you there. Other comments, questions?
Megan, I have a more general question for you, but I'd be interested. I just got off a televised episode with the Harvard University School of Public Health, and innovations was being looked at in terms of antimicrobial drugs and drug resistance. That's not my question. My question was the term and the meaningfulness of innovation. And from your vantage point, are there certain select innovations that you're detecting or picking up on along with your colleagues that you might share with us, particularly in public health?
That's a really fantastic question. I'd love to give it more thought, but the thing that immediately comes to mind is a conversation in one of the peer networks I was in about just, hire, like something as simple as hiring. And some of the barriers that many health departments have in getting folks hired, and the sustainability of that. So I think we're going to start seeing some innovative ways to, go beyond some of the things that they've done in the past, kind of relying on temp agencies or contracts, and trying to get some innovative policies and support in place so that folks can hire longer term and more sustainable positions, so that there's better retention of the workforce is one of the things that comes to mind. But we've certainly been saying the word transformation a lot with this grant. So related to your question about innovation, I think we are going to see some pockets of transformation, I think, and I hope with this grant. But I'm excited to see some of the incremental change in some of these areas that many of us not working in government take for granted sometimes, and just seeing kind of where we go over the 5 years. But I don't know if other folks want to chime in on that question. That was a great question.
Thank you.
I know that at the core of the program are foundational public health services, which starts getting you even further into the transformation, reorganizing the way you deliver services. And I know some states are establishing committees, commissions, whatever they call them, for looking at how they can reform delivery of public health services. So it's exciting to see. I see John Weisman up there. Washington State, of course, was doing that prior to all of this. But it's really important to know how this is helping to transform.
Thank you, Ron.
I see a question from Megan about the public health departments that may be doing this work with the MPH program. I believe Shelby County is one, right?
Yes, that's Memphis. Yep, exactly.
Yeah.
Yeah, I can look up the rest that were kind of interested and some other folks that might have chimed in that they're doing that. I can share that over with Mayela after to share out maybe as part of the meeting minutes. But yeah, I could take a look closer into that.
I was muting myself. I don't know if this was associated with the Public Health Infrastructure Grant Program or separate from it, but I know that there in Colorado with the Public Health AmeriCorps program, there is an apprenticeship program that has been established. So you have the volunteers going through the apprenticeship program, and then they could get into an apprenticeship, the volunteer program through the AmeriCorps, and then they can get into an apprenticeship program as an employee, continue learning, and be sustained as an employee.
Yeah, the woman who runs that program spoke on the same panel with the Shelby County director about the AmeriCorps program, and I think there was some folks from California as well who have a similar program. But yeah, those are kind of, I think, started before FIG, but are certainly being accelerated and scaled with the FIG funds, which is exciting to see. The full potential of some of these programs.
Sure. Well, Megan, I know that you have other commitments. And so we will let you get on with those. And let me thank you so much for having this discussion with us. Sorry we had to limit our audience, but again, we will make the recording available. And we do have our council members and associated staff with us today. So that's super. Again, thank you very much for sharing with us today.
Great. Thank you all for having me, and have a great rest of your meeting. Take care.
Thank you. So Liza, without further ado, I'm going to turn it over to you, and I guess you could tell people about your new job title too.
Yeah, well, it's good to see so many faces and names I recognize, and thank you again for the invitation to talk today. When Ron reached out and we were talking about exactly what would be of interest, he noted that this group has heard an awful lot about the Public Health Infrastructure Grant, obviously just heard an update from Megan, has heard a bit about the America Rescue Plan work occurring and some other scattered efforts from CDC, but there hasn't been a more holistic presentation or discussion of some of the changes that have occurred within CDC, including our new, a little bit of an overview of our new Public Health Infrastructure Center and the many different things that are occurring to support workforce throughout this particular center. So that's what I'm going to try and briefly do today. Next slide. And so what I'm going to do is quickly mention a little bit about our Public Health Infrastructure Center, which is the shorter and certainly more easy to say name of the National Center for State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce. It's a mouthful, so Public Health Infrastructure Center certainly rolls off your tongue a little bit more easily. And then I'm going to dive in a little bit more deeply about public health workforce and some of the particular efforts that are occurring throughout the whole center around strengthening the public health workforce. Next slide. I will say we all think it's pretty exciting. Next slide, go on. That we now have a center that has both infrastructure and workforce visibly in the title. So I think that certainly probably speaks to interests and work that many of the council member organizations are doing. So hopefully you all see that as exciting too. Many of you may be well aware of all the work that's been occurring first under Dr. Walensky's leadership, and more recently, Dr. Cohen has really picked up the mantle here with our CDC moving forward. This really speaks to, some of the core areas that have been emphasized. Obviously, there's a lot of emphasis on getting information out more quickly, and the science and data, and of course, communications. But I want to really point to two of those bullets right there in the middle of the slide, really ensuring that you're aware that workforce is a very visible part of the areas of interest that came out of moving forward as well. And that speaks to both CDC workforce as well as supporting the workforce in the field. And also, there's a very big emphasis on partnerships. And that's partnerships with national organizations, academics, community-based organizations, and of course, especially with our state, tribal, local, and territorial public health jurisdictions. But really thinking about partnerships in a results-based way so that, we know what's being accomplished and we can point to how the needle is being moved as a result of those partnerships and, if appropriate, the investments made through those partnerships. Next slide. So one of the things that has really occurred out of moving forward is, of course, there was a reorganization. And one of the bigger parts or the centerpieces of that reorganization was the creation of the Public Health Infrastructure Center. Many of you may be familiar with our previous organizational structure, in which we had the Center for State, Tribal, Local, and Territorial Support, CSTLS. And we also had our Center for Surveillance, Epi, and Lab Services, CSELS. And one of those divisions focused heavily on workforce. So most of CSTLS and that one particular division of CSELS came together to really create the Public Health Infrastructure Center. The idea being this is a real hub for information, support, and resources to support the health departments and our public health partners, and to support both infrastructure and workforce collectively. Move forward, next. And this, I just wanted to kind of highlight with the mission, and we should have a strategic plan coming out soon that I think will be shared and discussed in some public settings in the near future. But we do have a mission and some statements already that we're talking about. And I really want to highlight here, of course, you see both infrastructure and workforce as a pretty clear part of our mission. And it's really, speaking to supporting both the people, services, and systems needed to promote and protect health. Next slide. So I want to, because I'm a visual thinker, so I'm going to talk a little bit about what we even look like, because I think that's helpful. A big part of the new center is really found in 3 divisions, and that really speaks to some really key functions. I mentioned, of course, and I'm going to start on the right side here, the previous division, and many of you are familiar with Patty Simone, that had come from CSELS. Patty Simone continues to be the division director of what is now referred to as the Division of Workforce Development. And then we have 2, and that includes much of what had been in that previous division in CSELS. The Public Health Associate Program is now there as well as, of course, some other shifts and tweaks that always happen in reorganizations. But the other 2 divisions are relatively new and are comprised of work that supports partnerships and technical assistance and capacity building. So a lot of the work that we do to support the National Accreditation Program and competencies in the Public Health Law Program, the National Partner Cooperative Agreement, et cetera, that is all in the Division of Partnership Support. And then we have another division, the Division of Jurisdictional Support, where a lot of the big cooperative agreements and grants that you might be familiar with, like the Public Health Infrastructure Grant, like the Preventive Health and Health Services Block Grant, or our COVID Health Equities Grant, that is all out of what we refer to now as the Division of Jurisdictional Support. There's a lot of matrixed connections. So while I said the public health infrastructure grant is out of that jurisdictional support division, there's involvement from all three divisions, as well as, of course, the Office of the Director and other parts of CDC as well. And I'll point that out in a minute. If you go to the next slide. This is actually our organizational chart. And so you see across the bottom half of it, those three divisions I just spoke to. And then we have an Office of the Director. Now, I did acknowledge when Ron had introduced my name and my title, I kind of cringed because I was like, oh, wait, that's my old one. I had previously been an acting branch chief of one of those branches that you see in the Division of Partnership Support. And as of this week, it's my first week, I am now in a senior advisor position in third box down in the Office of the Director, that new Office of Program Strategy and Accountability. So I'm working on a lot of center-wide alignment. People who tease me, and I'm looking at Kay Bender and Paul Halverson about my love of crosswalks. There's a lot of work that relates to alignment in this new job, so my crosswalk skills will come in handy. But it's really making connections and trying to leverage a lot of the work going on across the center, as well as, of course, with other parts of CDC. So that is a very new and growing new office in our Office of the Director that I'm in now. I do want to point out a few others, and I'm actually going to speak to these with slides, that we now have an Office of Rural Health. If you move over one row, and also continue to have a home for supporting and directly engaging with tribes, the Office of Tribal Affairs and Strategic Alliances. But above that, you see our Office of Recipient Support and Coordination. That's where our most direct connection with the executive level and health departments. So with health officers, with the Big Cities Health Coalition, a lot of that happens out of that office. Dr. Jose Montero, many of you know Jose, actually leads that office. So he continues to be very involved in directly engaging with the field. So, so just kind of pointing out a few different examples. But if we go on to the next slide, I want to dive in a little bit, next slide, a little bit deeper on exactly what is occurring throughout the center around workforce that I think might be of interest to this particular council. So first of all, just kind of highlighting that as we think about what the center does, it's really about partnering with states, tribes, localities, and territories. So doing the work that, and I mentioned, the work that I'm doing in my new office, really a lot of focus on reducing burden, a lot of emphasis on leveraging work across the center and science and data. This is work that we're doing, also connecting with other parts of CDC. So if you go on to the next slide, there is also, I think, a big recognition, and I know I'm preaching to the choir here by pointing out this, but and I've got to give a quick shout out to our communications staff in our center. They actually helped pull together these slides. So some of these are actually the standard slides being used. So when I saw that they had included this, I was like, this is perfect. I know many of you will see this information and recognize it. And I'm preaching to the choir by even sharing this, but I wanted you to see that this is actually part of, some of the key talking points that are often included in CDC presentations, and what we are really using to push forward with the work that we're doing, and to, the rationale for all the emphasis and focus on building up the workforce and strengthening partnerships to address what needs to be done to support the field. Next slide, and the next slide. So with this last part of the presentation, I just want to give a few different examples of work that is occurring across the center. just so you can see where some of the different areas of workforce activities and efforts are occurring. So you know about the Public Health Infrastructure Grant. Obviously, Megan just spoke to that. I know Steve Reynolds has spoken to this on previous council meetings. You've been hearing about it. This is a kind of a quick overview of some of the key points of it. I mentioned that it is directly, like all of our project officers, for example, so it's directly supported out of our Division of Jurisdictional Support. But there's a lot of engagement from all three divisions, especially where it relates to, the Division of Partnership Support, of course, working with those component B partners, ASTO, FAB, and the National Network of Public Health Institutes, as well as, some of the work related to foundational capabilities. Our Division of Workforce Development is very heavily engaged, especially around the workforce-related activities. And then another part of CDC, our new Office of Public Health Data. Oh, see, I can think of the acronym OPHSTD, but I can't even think of it. It's not rolling off my tongue quite yet, but we have another part, which is that leads the data modernization initiative work. And they're very heavily engaged as partners with the FIG grant, supporting especially that third part, the A3 strategy around data modernization. Next slide. But it's not all just about the Public Health Infrastructure Grant. We have so much else going on. Did, of course, already mentioned the Division of Workforce Development. That, of course, is the home, and I know Michelle Carvalho is on the call today, but that is the home for a lot of the fellowship and training programs that you're familiar with, like EIS and now PHAP. And others, but also, the support for TRAIN. And also, you may or may not be familiar with the fact that that division actually coordinates a fellowship forum across CDC fellowship forums. So coordinating a lot of the work across CDC, fellowships and training programs, so that there are connections built within CDC to learn from each other. Next slide. It's just a few examples. I did want to call out one other piece of work that occurs out of that division. This new CDC and HRSA workforce, Public Health Workforce Research Center. And I included the link at the bottom if you want to learn more later on. But I think this is a pretty exciting opportunity and nice collaboration with HRSA to support workforce research, both through this consortium of academic institutions. And it also includes the opportunity for funding rapid response research projects. So I think there's some neat stuff going on that's occurring through this. And if you've heard JP Leiter or Val Yeager or others talking about this, that they are a couple of the folks, for example, who I know have been presenting about some of the work occurring in these initial years of this Workforce Research Center. Next slide. You saw when I had shared the org chart that we now have a little box in our Office of the Director for an Office of Rural Health. This is, we think, tremendously exciting. Many of you may be familiar with that. HRSA has long had a formal Office of Rural Health, and while CDC has been doing work in rural health, we haven't had a formally established Office of Rural Health with a line item from Congress. And so this is new and it's exciting. And Diane Hall is our new director, now permanently named director of the Office of Rural Health. So this year, of course, is just being spent kind of getting itself established and determining a strategic plan and building those connections across CDC. But I wanted to especially call this out because workforce is a big part of this. As you might know, this is recognized as a big gap and area of need. So there is a lot of attention to the rural public health workforce in the work that Diane and colleagues are doing out of that office. Next slide. Similarly, our Office of Tribal Affairs and Strategic Alliances, many of you familiar with the fact that we did have a similar office in the old Sea Stilts. They continue to do some of that same work, playing that, point place for the point of contact with tribal nations. A big part of that work is, of course, an interest in supporting and building and strengthening the workforce that supports our tribal nations and our American Indian, Alaska Native populations. Next slide. Ditto to the work that we're doing out of our Office of Island Affairs, which is located in our Division of Partnership Support. Again, there's a big emphasis on workforce, as well as, of course, all the programs and funding that's needed to strengthen those public health systems. Next slide. And then this is kind of a bit of a catch-all. I just wanted to kind of acknowledge that those are just some of the many examples across the center. You're well aware that, of course, CDC, and this occurs out of the branch that Michelle is in, that Gabby Benenson leads, that we continue to support, train. But there has been, I think, some other collaborative work that relates to that. So, for example, our CDC Office of Health Equity, as well as folks in our Division of Partnership Support, and out of Gabby's branch and Michelle, there was a kind of a collective effort to develop some health equity training plans and a social determinants of health training plan. Those were just released and launched, and I know they were put on. We worked with PHF to get those on train. We continue to support workforce competencies and, of course, the national accreditation standards that have a big emphasis on workforce, and there are, I think, different leadership and training programs, and of course, where grants and cooperative agreements really leverage, in many cases, really being, I think, well leveraged, but could, possibly even improved in terms of how they support and are aligned to strengthen the public health workforce. And so a lot of the work that we're going to be doing is really looking at, how do we continue to reduce the burden on recipients while building those connections and understanding, what's occurring in the field, and continuing to strengthen the science. So with that, I am going to end there, see if there are any questions. And on this last slide, you can see our communications staff actually really do help multiple people, because I see they have Jose's name on the last slide. That makes me laugh. So I think they forgot to update that one. But shout out to them for helping me with pulling these together. So I'm going to pause, and Ron, back to you.
Great. Well, thank you, Jose. Jose, we really appreciate it. Just one comment before getting questions, comments from the rest of the people in the meeting. For years, Liza, you have worked with people in C-cells. Well, Michelle is a perfect example. You and Michelle have worked together and collaborated on lots of things. Now bringing it all together, workforce with the rest of infrastructure for governmental public health in one place, seems like a real coup for the organization. It's not consolidating, it's expanding the focus on workforce. So whoever made the decision, great decision, and congratulations on your new role there as well.
Thanks. Well, and I think I just want to point out a perfect example of collaboration. So Michelle and I were touching base prior to me doing this, and she said, I'm going to pop those links in the chat as you say them, and you'll see that they did, that she did. So those links to some of those new plans, as well as the Introduction to Public Health Practice plan that had been also put on train. Thank you, Michelle, for popping those into the chat.
Perfect.
Teamwork.
So lots of excitement at CDC. We'll ignore the whatever is going on in Washington at the moment, or not going on in Washington at the moment. What questions, comments, thoughts do people have? I know there must be some. Okay, maybe I should reframe it. What advice do people have?
Liza, hi.
Thank you, Terry.
If I may, and I want to give you some latitude with this, but could you go back to the rural health initiative? I thought that slide was an important one. I have a question about one of the elements that I'd like to ask you about. If we can't call it up, it has to do with communications.
Of course.
There's a huge, as everyone online today knows and beyond, there's a huge communications issue that has to do with the public health infrastructure in rural settings. And I'll just take one example. Broadband is a major issue right now. Connectivity of the community so they have accurate information rather than misinformation and disinformation. Do you see, and I know it's in the formative stages, but do you see efforts being made in communication, not only among the professionals, but also with the greater communities that are in the rural settings? And broadband is the one that comes to mind here in the Midwest.
Yeah. So Mayala, I don't know if you're the one advancing it. I think that may have referred to the rural health slide. That's probably 5 or 6 forward. Yes. So I think when we talk about infrastructure and we talk about what needs to be done, there's there's obviously a lot that's happening out of moving forward and in all the different parts of CDC that relates to communication. And a lot of that does relate to the communication skills, as well as rebuilding trust and the rebuilding those communications. But it also, I think there's the acknowledgement that there's the hard infrastructure communication needs that are relevant as well. And you mentioned broadband. I know there are other federal agencies that are, of course, very involved in supporting a lot of that infrastructure building as well. And there have been efforts here at CDC to work more across sector, not just that of the Office of Rural Health, but a lot of this relates to cross CDC social determinants of health task force, where we're really connecting to say where can we build and leverage support across some of these federal investments either at the federal level or supporting states and localities in doing this to support what's needed in communities. And I think the kind of infrastructure that you're mentioning is a perfect example of where there can be those kinds of investments, but also that can come out of that also can relate to supporting transportation, school, health, et cetera. So there are a lot of opportunities there that I think that speak to, some of the needs, not just of rural areas, but of all the types of communities.
Great. Thank you for your insights. I appreciate it.
So Terry, I see your hand up.
Thanks, Liza. Thanks for the update. Really appreciate it. Speaking from a local public health perspective, first of all, the foundation, the grant process is outstanding, and we haven't seen this type of investment in years. But as we look at how it's rolling out, I think we have to assume for the majority of our local health departments, we'll be receiving our funds through states, I think, with the exception of the big cities and some larger counties. So the majority of health departments will be able to access the funding. And from a local perspective, you get down to that make or buy. Do you go out and buy capacity, or do you make it within and through some organizational change? And that's always a dilemma. The going out and buying, I know 80,000 FTEs, that's a tall order, you know, to increase your staffing. And that gets tenuous when you're using federal money, which I hate to say, we often call it soft money, is used to bring on permanent positions because the soft money goes away. And then and your governance organization, your boards of health, your county boards, they're wise to this. You know, the first question they have is, what are you going to do when the money runs out? You're going to put on local tax rolls. So so you're in that make or buy situation, and I'm thinking there's going to be a tendency to go towards the making if you need capacity. Some really good tools have come out. You know, of course, we have our core competencies. We've got a workforce calculator. We've got the framework for the foundational capabilities. All that's really good in terms of carving out a vision for what your department should be within the vision of Public Health 3.0. So I think that part of it is there. Now, how we get there, how we implement, it may be more of the making of you know, and it's going to come internally, I believe, in terms of that capacity. If you need EPI capacity, you need GIS capacity, it may come from, you know, your personal care clinical services. And we know that, which as a former public health director, doesn't always go well if you're not going to fill, say, a PHN position for a public health specialist. Not always a great conversation to have when you're doing that. So anyway, moving forward, I think the making or the training, I think, is going to be the key. And I think linking up more formally, I think right now it's more of an informal relationship with our many schools and programs of public health, I think are going to be a key. And I think forming partnerships in that is going to be able to give you access, particularly with the many online programs, to get those skills and abilities. But 80,000 FTEs, I think that's going to be a tough one, at least from a local public health perspective.
Yeah. I think that 80,000, of course, only really refers to the foundational capabilities and maybe not even to, you know, some of those additional needs that might be needed in areas. But I think I think you're exactly right, Terry, that this investment is important for building up the workforce, but there's also challenges. We know that there are challenges with hiring and civil service laws, but a lot of that, of course, can either, and I know that's a pretty prominent aspect of some of the questions coming in, that if Megan were still on, she would be able to you know, speak to just how much that is coming through in the public health infrastructure grant, you know, peer sharing and learning process. But partnerships with academic institutions and public health training centers and with community-based organizations and with, you know, with other types of organizations are also going to be an instrumental, I think, part of the solution. I think also the addressing and building up the capacity and strengthening those foundational capabilities in the workforce in a way where it's more about focused on the what, not the how, is very important, because solutions like more service sharing and resource sharing, you know, regionalization, not necessarily changing the structure, although maybe that is needed in some areas, but even just you know, cross-jurisdictional sharing, such that there are, you know, staffing that occurs on a more regional basis or can be tapped from the state level, you know, that brings solutions that might be more feasible, especially in rural areas where there are limits in terms of the capacity or the workforce that might be available. So yeah. This is, I think, the beauty of course, you know, building all this peer learning and the interaction that'll come, or that is already occurring, between all of the grantees and the other partners that are involved among state and local grantees, and of course our national partners that are part of this effort and others. So.
And Liza, if I may add, looking at how states have invested in transformational public health is important as well. So we have, Washington State, right? Mentioned them before, but we have also, Terry, a almost neighbor, Indiana, which has a conservative governor, conservative legislature, and they increased funding for public health by 1,500%.
Yes.
So how did they do it? And how do we replicate that? They've obviously determined there's value to public health and want to have a long-term investment there. So the feds help to invest some through FIG and other means, but now they want a long-term one.
Yeah. Yeah. Indiana is a great story and is being talked up a lot. It helps that, of course, Judy Monroe is of course helping to also share that story with some of the key leadership from her vantage point at the CDC Foundation. But I think that, that brings that's a great, from the field example, of how to kind of foster that buy-in among around among legislators and others to really build the infrastructure. And of course, Washington and Oregon and others are more long-time examples that also give us some great examples for measuring progress and where the investment has gone.
Great. So Liza, thank you so much.
You're welcome.
All the
Thank
best
you.
in your new position. It's wonderful, and the new center, all of this is great for continuing to advance our rebuilding the public health workforce.